Mary, thank you for hosting this amazing documentary. There were so many lessons in it. Indeed, it points to one of the biggest problems in healthcare. You see, the biggest problem in healthcare, and I'd say the world, is our inability to solve complex problems collaboratively. Just look, 1 in 4 patients are still harmed. It's been that way for 20 years. 1 in 2 suffer because they don't know how to care for themselves when they leave the hospital. All but the very rich suffer long waits to get access to care. Labor productivity is negative despite spending crazy money on healthcare IT. Costs are increasing, revenues are decreasing, and 50% of hospitals have negative margin. Indeed, as a result, the very idea of not for profit healthcare is threatened. Yet it doesn't need to be that way. Here's the thing, the core reason is a lack of love. Now, I know that probably sounds esoteric, so let me explain what love means to me. Love is an energy that uplifts and connects us all. Love is a force innately in each of us, and that means we matter. We are born worthy of having respect, of having our voices heard. Love sees the wisdom and beauty in every person and invites their ideas to the table, regardless of their pedigree. Love is the absence of separation. Yet too often we are separated. We look down on people. We think we're smarter than them. And so we deploy top down command control solutions that never work. We say if you don't have the right degree or title after your name, or you don't go to the right college or study the right discipline, then your voice counts less. To such an extent that some people believe they're less worthy. When we discount ideas, we demean, demoralize, decrease innovation, and destroy the ability to solve problems. When we live and lead with love, the opposite happens. We believe in people as innately good. We feel we matter. We respect, uplift, and unleash. We seek good ideas and effective solutions from wherever they emerge. We focus on what works rather than on what discipline brings forth an idea. When we leverage the power of love within and between people, we solve problems better, faster, cheaper. Learning and innovation flourish. Let me be clear, this is not some feel-good philosophy without accountability. Love is the path to proven performance. It's resulting in UH getting national and international quality awards, and now from the worst 10% to the second lowest cost ACA in the country. That's the leadership the world needs. It's the leadership healthcare needs. So how might we leverage the power of love to solve some of healthcare's most pressing problems? Well, the documentary points the way. Engage diverse disciplines to solve problems. We know innovation occurs at the intersections of disciplines rather than within disciplines. It occurs when diverse ideas meet, mature, mate, and multiply. So let me share with you a story of innovation based on love. I had developed a remote patient monitoring technology, a company called Doctella, where you can sync your cell phone to a variety of sensors like a pulse ox. We sold it to Massimo with the idea of syncing it with their pulse ox and other technologies. I have no relationship with them now. When COVID hit, I called their CEO, Joe Chiani, and said, hey, Joe, did you ever get FDA approval to pair Doctella with the pulse ox? Because we're overrun. We don't have beds. We're building these 1918 military hospitals that have no technology and people are going to die, but most people have a house. If we can get this technology into their home, we could save lives. Joe said, well, I didn't, Peter, but we applied for the FDA approval for drug overdose. And I said, okay, could we get emergency use authorization call with the FDA tomorrow to see if we could get approval? So we did a call. It's kind of unheard of that you'd get it that fast. And we pleaded our case. We said, people are dying. You have a technology. It's what's used in the ICUs. Could you allow us to do it? On the spot, they gave us approval and said, go do that. The next day, the team from Massimo and the team from UH met together in Cleveland at UH. There was no product at the time. They just had it approved. And we iterated and prototyped. We huddled 2 times a day. We told the engineers what we needed to have them built. The engineers said what workflows, what things we needed to do, but there was no finger pointing. We respected everyone's ideas. 4 days later, we launched our first patient. 30 days later, we had several hundred. We hosted a webinar with WHO that had 80 countries, 800 health systems to share what we've learned. Today, tens of thousands of people on it, and we published our story in JAMA showing that this technology reduced hospital admissions by 87%, mortality 77%, and reduced the average cost of care by $11,500. That's leveraging the power of love to transform care. So how might we accelerate these insights for you to have impact? Well, there's a couple key conditions. First, we need to stop believing that harm is inevitable and start believing that it's preventable. Change that mindset, because if you don't, we'll never make progress. Second, we need to live some core principles. And most importantly, that I am humble, I am curious, and I am compassionate. Excellence is impossible without these values. In our education system, whether that's formal or informal, what that means is you need to be more like a jellyfish than an elephant. So what do I mean by that? Most of our training has one long methodological discipline, a long trunk of the elephant, and we know preciously little about anything else. So I may be in medicine, or I may be in informatics, and I don't know other things. What we need to be is like a jellyfish. I need one long tentacle. I need that discipline and excellence, but I also need many short tentacles. In my case, in engineering, in systems engineering, in behavioral economics, in informatics, in math, in social psychology, in organizational theory. Why? Because we align all those different principles from those disciplines to move the needle in a really big way. You see, improving healthcare is about changing the behavior of humans. And if you don't get the human and the culture side right, the tech doesn't have a chance. And third, most importantly, go pick a problem and go at it. I want to share with you a story how we took this, we call transdisciplinary approach to solve a problem that killed 3 times more people than breast or cancer or prostate cancer. It's a story of central line infections. You see, after an adorable little girl, Josie King, died of a catheter infection in the PICU at Johns Hopkins after being burned, the little girl who looked hauntingly like my daughter, Emma, who's now luckily an M1 at Case, came up to me and said, "Could you tell me that this won't happen to my other daughters?" And it was like this moral moment. I wanted to say, yes, of course, we're great, as many executives want to do. And I looked at her and said, can't. We didn't have a good program. Our infection rates are sky high, but I will. So we got at it applying this living and leading with love approach, this discipline, bringing them together. And we drew from many disciplines. We created a checklist from engineering and aviation. We used human factors to design a cart because that checklist required 12 different pieces of equipment and they're all stored in different places. It was silly. So we just designed a cart that had everything. We use systems engineering. There was a soap chlorhexidine that is 50% more effective than betadine in reducing infections, but all the kits in America had betadine. So we called the companies up and said, hey, we have a whole bunch of hospitals. We'll use it if you swap it out to chlorhexidine. Could you swap it out? 2 months later, the whole country was changed. We used behavioral economics and ordered hospitals by their infections rate and created healthy competition. We used team science where we encouraged nurses to question physicians who weren't using the checklist and empower them to stop takeoff. We used management sciences where we had CEOs and executives review performance of teams and celebrate and those learn from those doing well and support and require that those not doing well get better. Perhaps not surprisingly, those infections went away at Johns Hopkins. We deployed them through the whole state of Michigan. They were reduced by 70% in 6 months. That was published in the New England Journal. We then spread it state by state across the US. Now, 15 years later, they're down by 80% across the whole America, a problem the size of breast cancer. And we spread it to 8 other countries with similar results. But most importantly, it showed the world that little girls do not need to die just because they get health care. It showed us that harm is preventable rather than inevitable. Love is the most powerful and potent and precious gift. Yet to have impact, someone has to believe and say, this is a problem, it's within my power to solve it, and then convene a group to go do it. That someone, my friends, is you. May you go live and lead with love. Thank you.